welcome back. This is the third section of your female disorders discussion. We're going to move on to uterine disorders. These would be anything that's disrupting normal uterine activity. And we'll address the two most common ones here, and that is myomas and endometriosis. Myomas are the formation of fibroids. I'm sorry, I'm getting whiteouts because of the snow, I think. I'm not sure. But these fibroids are masses, if you will, and that's what they'll call them on an MRI, a CAT scan. But they are benign tumors that are growing in the muscle wall of the uterus, and some contributing factors. Just so you know, African American women who are over the age of 30 and nulliparous do have a significantly higher rate of developing myomas or fibroids. But that's not the only people. Women who are post-childbearing or perimenopausal also can develop fibroids. Once she goes through menopause, they will begin to atrophy because the change to the lining of the uterine wall does decrease the size of fibroids. The manifestations, signs and symptoms could be pelvic pain or pressure. She may have, if she's still menstruating, hypermenorrhea or really difficult, lots of bleeding and just difficult menses. And she may also feel like her girth has changed a little bit. Some women will feel that abdominal girth change. The management for myomas is really twofold. They can either be, if they're large enough, surgically removed, and that can be done laparoscopically, or classically through a hysterectomy, removing the entire uterus, which is not favorable unless it's quite large and it occupies over 30% of the uterus. And medication. And the medication of choice is actually oral birth control pills, which will hopefully regulate the changes that are happening in the uterine wall. The second disorder of the uterus that we're talking about is endometriosis. And endometriosis is the proliferant growth of endometrial tissue, which is the tissue that lines the uterus, outside and beyond the uterus. So it really should only be on the inside of the uterus, but women who suffer from endometriosis, if we were to do scans and studies, we'll see that the endometrial tissue can grow on the outside of the uterus, up the fallopian tubes, around the ovaries, down into the vaginal canal, into the cervix, and it can really wreak havoc in a normal female cycle. So she may have very difficult menses. She may have fertility issues. She lacks regularity often with her menses, and it's quite painful. Women who suffer from endometriosis really need a lot of support because they suffer almost daily from normal living. Some of the contributing factors, it is believed to be hereditary, meaning that it's passed from mother to daughter, and it also can be associated with an impaired immune system. We've talked again about those manifestations with severe dysmenorrhea, low abdominal pain, painful intercourse, back and rectal pain, especially if it's growing into the retroperitoneal area. She can have abnormal bleeding. The management for endometriosis, typically they'll start with hormonal therapy. So again, the birth control pill might be used. They can also do surgery or surgical procedures to remove the accumulation of the endometrial tissue. And interestingly enough, pregnancy will actually typically quiet this. So women who have had endometriosis, if they have the complication of infertility, but then if they're able to achieve pregnancy, they actually have such relief from the endometriosis that it's not unusual. They can have a good pregnancy, a stretch of time where they're not in such discomfort. So that's kind of an interesting thing with endometriosis. That ends chapter 57, Female Disorders. Thank you.